Hello, and thank you for having surgery with Dr. Richard Greco. This video will go over the instructions on caring for your TLS and JP drains after your surgical procedure. TLS drains are small test tubes that are used after facial procedures to aid in the removal of excess drainage. A patient may have up to 5 drains in various locations, such as the cheek, neck, or brow. Each drain needs to be changed every 4 to 6 hours or when they are half full. To change a TLS drain, simply detach the old tube from its holster and reinsert a new test tube. Sometimes, string-like clots clump together in the tubing. This can block the flow of drainage. To unclog the drain, first detach the plastic tube from its white base and insert the small needle back and forth to remove the clot. Then, replace the plastic tube to its white base, followed by a new test tube. Your TLS drains will be removed in our office on your second postoperative day. After removal, you may begin to wash your hair as needed, but do not submerge the area in water until your incision is completely closed and there is no drainage. The small hole from your drain site will close up on its own within 24 hours. JP drains are generally used for breast and abdominal procedures. This drainage system draws out fluid that collects under your incision through a flexible tubing which empties into a bulb. When the bulb is compressed or squeezed, with the stopper in place, a constant gentle suction is created. The bulb should be compressed at all times, except when you are emptying the contents. Your JP drain needs to be emptied every 4 to 6 hours, even if there's only a small amount of fluid present. Begin by washing your hands well with soap and water. Pull the plug out of the drain. Pour the fluid within the bulb into the provided measuring cup and record the amount. Be sure to record the output of each drain individually. Clean the plug with alcohol, then squeeze the bulb flat. While the bulb is flat, put the plug back into the bulb. Remember that it is very important for the bulb to remain squeezed at all times, as this promotes the vacuum suction for your drain. Please do not allow the bulb of the drains to just hang. Always secure them to your clothing or abdominal binder with a safety pin. It is not unusual for clots to form in the tubing and block the flow of drainage. You can strip the drain by pitching the tubing close to where it goes into your skin between the thumb and forefinger of your hand. This will help to make sure that you're not tugging on your skin, which can be painful. With the thumb and forefinger of your other hand, pinch the tubing right below your other fingers. Keeping your fingers pinched, slide them down the tubing, pushing any clots down toward the drainage bulb. You may want to use alcohol wipes to help you slide your fingers down the tubing. The amount of fluid that you drain will decrease as your wound heals. Each drain will be removed at different intervals depending on its output from your drainage log. Please remember to call our office at 10 a.m. every day to report your 24-hour drainage count from each individual drain. We are excited to be on your road to recovery. Please know you can always contact our office with any questions or concerns at 912-355-8000. Please stay tuned for common occurrences and troubleshooting techniques for problematic drains.